Our science correspondent Thomas Moore joins me now. And Thomas, it's just been announced that new restrictions will be introduced in Wales, where from the 27th of December, there'll be new social distancing rules in workplaces and nightclubs will be closed. Clearly, there's growing concern about the spread of Omicron.
Yes, and many scientists would argue that there need to be tighter restrictions across the country because that's going to be so important in buying time to roll out the booster. But that the government is relying on that as its mainstay for dealing with the Omicron variant. And 750,000 people today did get their booster. But is it the right people? We know that it's really important to give protection against the new variant. But I've been digging into some of the detail of data released today by the UK Health Security Agency, which shows that there are almost 1 million people over the age of 65, those most at risk from this variant, who have yet to receive their booster. And these aren't vaccine refuseniks. These are people who've already had 2 doses but are waiting for the booster. At the same time, there are 3.4 million aged between 50 and 65 waiting for theirs. And yet, there are 1.6 million people under the age of 40, low-risk people who have managed to get theirs already. So questions over whether the jab is being prioritised properly. But the Chief Medical Officer, Chris Whitty, was before the Health Select Committee today, and he was saying that it's very possible that you get this big rise in cases, which will lead to a big rise in hospital admissions, a very sharp peak, which is going to put hospitals under great pressure in the coming weeks. But it depends also on the severity of the variant. It's entirely possible that people need hospital treatment for a much shorter period, and therefore they need a bed for less time and clearing it for the new admissions. But he did also say that there are brighter skies ahead, that it's likely the pandemic is going to last for the next 18 months, but each successive 6 months will be better than the last. And that, I think, is something to cling on to.